That's all right. Hi, this is Steve Bowen with the Iowa Occupational Therapy Association. Welcome to our video. Today we're talking about wound care. And today we have a special guest with us, Brandy Ringholtz. Welcome.
Thank you.
And if you could just start out by letting us know a little bit about yourself.
So I'm an occupational therapist and a certified wound specialist. I work at Mercy Medical Center in Des Moines. I'm part of a team of wound care clinicians, wound ostomy continence nurses, and myself, and we look at people from head to toe and make recommendations for their wound care.
That's wonderful. How did you get into this?
So I went to school in St. Louis, and then I worked in Houston for a year, and then I moved to Atlanta, and I worked there for several years. There are a lot of therapists who do wound care in Atlanta. When my daughter was born, then I took a part-time job where it was a hospital job. And if the injury was an arm injury, OT would take care of it. If it was a leg injury, PT would take care of it. If it was a torso, the wound ostomy continence nurses would take care of it. So over time, our teams combined, and so that's how I began on this journey.
Oh, that's wonderful. And so now you work with as an occupational therapist in wound care.
Correct.
So tell me a little bit about why OT should be involved in wound care.
Well, I think that we are great holistic caregivers. So doing that head-to-toe assessment has been awesome. And I didn't do that at my previous job. It would be like, if it said arm, I'd be looking at the arm. Now I think I'm a better clinician, and some of that is time, and some of that is seeing so many things. But we see people, OTs and PTs, we see people, their whole selves. So we see how they move, we see how they can take care of themselves, we know how well they eat, we know a lot about positioning. So we are kind of experts on the whole person, and so we really help. I think we have a lot to bring to wound care.
And so for somebody who may be just maybe a new graduate or just a general practitioner, what should they be doing in wound care? Because it takes a special certification, but what can general practitioners be doing with wound care?
Well, I think that a lot of therapists, some of our therapists see maybe hand and arm wounds. Some people do positioning, and so they look at people's, their torsos and how well they're sitting. And we have some people, obviously, we work with mobility. I would say that one thing, like one of my soapboxes is, if we have a patient with neuropathy, we should be checking their toes and their feet when we're handing them a sock. If we have a patient who has a mobility impairment, then when we're working on grooming or turning in bed, then we should be checking those bony prominences. If we know the person's got an injury, then we need to kind of work with the staff so that after we are working with them, we can reposition them the best way to offload or redistribute pressure on those areas. So there's some really simple things that we can do that make a big difference.
So just taking some of those general knowledge that you got from occupational therapy school, for example, we could be advocating, even if it's somebody maybe not necessarily our patient, but we might notice somebody who may be uncomfortable or sitting wrong in a wheelchair, and just bring that up with the staff, saying, hey, let's make sure that the positioning is correct, those kind of things, and understanding moisture issues and positioning is, I think, part of that as well. Would you agree with that?
I would, absolutely.
Okay, good. So tell us a little bit about your certification itself. Where does that come from, and how did you kind of get that?
So I have a certification from the AAWM. It's a board, a national certification. There's a lot of different healthcare backgrounds that would make you eligible to be a CWS. In this case, you have to have a certain number of years of experience, some letters of recommendation, and then pass these boards. And then every 10 years you have to pass the boards and keep a number of CEUs every year that you do it. So that's how you do it.
Oh, good. So you do keep that up all the time and,
yes.
and do the CEUs? Very good.
Yes.
Because I know there's a lot of people in Iowa that ask about that and trying to advance their careers, or even just getting some more information and more knowledge. And so one thing we just want to stress is that in Iowa, in any state where you are, you just make sure that you're following any state regulations regarding scope of practice, licensure kind of things, making sure that you have that demonstration of expertise if you're going to be doing that. If you have any specific questions about that, reach out to me. I'd be more than happy to get you in touch with Brandy. And if you do have questions, we can also reach out to the state board to find out exactly any kind of certification issues or licensing issues. But we just want to thank you for being here. Is there any other final comments you have? Or?
No, actually I do. So in the next couple months, there's going to be a lot of discussions about who can provide wound care services and being reimbursed for it. So I'm going to be speaking in Washington, D.C. with the APTA and I'm there for OT. So I kind of am inviting feedback because I want to speak for OT and I want us to be a part of the picture. If I'm the only one who wants us to be a part of the picture, then maybe we shouldn't be part of the picture. However, we have so much to bring to the care of our patients, the holistic care. So let me know what you think. What can we do to be better wound care clinicians and take better care of our patients, even if we don't have a certification?
I love that. Thank you very much. That was a wonderful way to end the video, and thank you for joining us with the Iowa Occupational Therapy Association. I hope you have a wonderful day.